Hi, it's Ruth from Energy Works Myofascial Release, and today I want to talk a little bit about how you can stretch some areas within your mouth that are really meant to keep your part of your body stable. Okay, we have three stabilizer muscle groups in your body. One is the lowest one is your piriformis muscles in your butt. Another pair is in your abdomen called your psoas, and the third pair, they're called pterygoids at the back of your jaw. So the pterygoids is what we're going to talk about today, and why they become important is they are one of the three pairs of stabilizer muscles, but they can also contribute to some of the uneven tightness in your jaw, where some people might be tight on one side and not on the other. You might have some TMJ type symptoms. Sometimes people get headaches when these are tight as well. So one way that you can open them up from the inside, or at least open them up so they can move much more freely, is to treat from the inside the mouth. So I'm going to show you how to do that. You can actually treat both sides at the same time, or you can treat one side. So I'm going to teach you how to treat one side, and you can decide if you want to do both at the same time. This can be messy. You're going to be dealing with the inside of your mouth. So what I actually recommend is make sure you wash your hands. If you have gloves available, I would use gloves. That's just my personal preference. So I have a gloved hand here. Okay, my hands actually are washed. I have a gloved hand. And what you're going to want to do is you're going to take one finger, doesn't matter which one, whichever one is easiest for you. I tend to use my index finger just because there's some additional things that I can do inside my mouth, and I can just continue on after that pterygoid release. So how you would find this muscle group is between the upper and lower teeth in the very back, there's some fleshy tissue, okay? That's your pterygoid muscles right back in there, okay? So you can go directly to the center of it, or you can go to the inside a little bit or to the outside a little bit. It doesn't matter. For some people it's very tender, and other people it's not tender at all, okay? So what you're gonna wanna do, again, I'm gonna use one finger, and when I do this, I'm gonna do it on the opposite side just because it's easier for me to do that, okay? So I'm gonna take my finger and I'm gonna go between my upper and lower jaw at the very back of my teeth, and I'm just gonna hold pressure there for 3 to 5 minutes, okay? So I'm gonna be quiet while I do it. Again, it's right in between the top and bottom teeth, that fleshy tissue right in the center there. Just like that. So I'm not going to stay there for 3 to 5 minutes, but you get the point. Now what you might feel is if you're holding your mouth open, you actually want to relax it. So what you might have noticed is once I put my finger back there, I just actually let my jaw just close on my fingers. I'm not biting my hand. It's not going to hurt anything. So that's a way that you can work on that pterygoid muscle on both sides of your jaw. Okay. One of the things that I like to do when I'm done with that is I like to continue it on and actually work along the cheekbone here a little bit. We tend to clench a lot, especially at night. If you've got TMJ symptoms, you tend to clench a lot. We tend to get really tight up in our masseters here, this muscle group. So what I like to do when I'm done with the release of the pterygoid muscle itself is I like to just turn my finger out. And this is what I'll do in my office as well, is I turn my finger to the outside and then I just slowly push my finger towards the outside just to create some opening of my jaw and opening of the cheekbone area, and then I just slowly draw my finger up and around up in the mouth itself. So it's a gentle movement. I'm not forcing anything. It should not be painful. It should just feel like a good stretch, okay? So I'm going to show you what that looks like. I'm going to do it, and you know, it's not going to be slow motion. It's not going to be 3 to 5 minutes, but you want to actually make that whole move last about 3 to 5 minutes, okay? But I'm going to show you what it looks like just while I do it quickly. So pterygoid, turned. See my cheek? My cheek is going out there. Slowly. Okay? So I went out and then I went up and around. Now what I would do when I'm treating, and what I can do while I'm self-treating as well, is as I'm slowly moving along that cheek, if there's a spot that's really tight, I'm going to want to stay there for a little bit. If it's hot, I want to stay there for a little bit longer. If it's tender, I want to stay there a little bit longer. So you're really just feeling for where is that resistance coming from, and you want to hang out there. And as it eases up, then you get to just move a little bit more. So that whole process can take about 3 to 5 minutes, okay? But that's just one way to get some additional space and opening things up. Could affect some of the sinus area here. It could affect your cheekbone and your TMJ. So it's just a nice addition to that pterygoid stretch itself. Hope that's helpful.